Good day, everyone. I am Riza Eileen Bulalok, and today I will discuss feminist therapy, application, therapeutic techniques and procedures, and feminist therapy from a multicultural and social justice perspective. The role of assessment and diagnosis. Diagnoses are based on the dominant culture's view of normalcy and therefore cannot account for cultural differences. Feminist counselors are concerned about problems inherent in the prevailing diagnostic and statistical manual of mental disorder, 5th edition, or the DSM-5 medical model diagnostic system. Since Phyllis Kessler in Women and Madness articulated the view that the DSM approach pathologizes any difference from the standards established by the dominant group in the society, feminists have argued that it is important to assess not just symptoms and behaviors but also the context of women's lives. Within this broader context, many symptoms can be understood as coping strategies rather than as evidence of pathology. Thus, feminist counselors use a broad biopsychosocial-cultural structural model of assessment and diagnosis. Using this broader approach to assessment, feminist counselors familiarize themselves with the literature on gender and its relationship to clinical judgments of mental health and examine their own biases and expectations related to societal positionality. They actively inquire into the meaning of these positionalities for the client, assess the rewards and penalties of rule compliance or non-compliance for the client, attend to the client's responses to the counselor's cultural characteristics and their own responses to client's culture, and check their diagnosis to guard against inappropriately imposing stereotype values of mental health. Arriving at a diagnosis is a shared process in which clients are the experts on their distress and its social meaning. The client's understanding of the meaning of their behavior is considered equally with the counselor's interpretations, and client's strengths and resiliences are identified. According to DSM-5, studies have demonstrated a higher prevalence of major depressive disorder in women than in men. From a feminist perspective, women have many more reasons than do men to experience depression. Women who are taught to be helpless and dependent and to please others may feel that they are not in control of their lives or their environments. Their subordinate position, along with their experiences of domestic violence, sexual or physical abuse, poverty, harassment, or sex discrimination in workplace can result in a sense of powerlessness that can manifest as symptoms of depression. Feminist counselors work to help clients reframe their understanding of the causes of their depression so that they can move away from blaming themselves for the problem and from believing that they must adjust to their circumstances. They help clients become aware of their external forces that limit their freedom so clients can release self-blame and focus their energies on circumstances they can influence. So, feminist therapies refer to distress rather than psychopathology. Feminists believe that instead of focusing on psychopathology, they must cater to the distress that the client feels. The feminist approach has called for a reformulated understanding of psychological distress. Feminist counselors reject the medical or disease model of psychopathology. The notion of psychological distress is reframed so that it is viewed as a communication about the experience of living in an unjust society. So from this new perspective, psychic pain is not seen as a symptom of disease or deficit. Instead, it is defined as evidence of resistance and the will and skill to survive. So according to Brown, resistance is a term that describes a person's ability to remain alive and strong in the face of oppression. Thus, a client's problems in living are not assumed to arise from within that individual but instead are assumed to derive from multiple sources within a complex social context. Next, we have here the limiting reasons for diagnostic labeling. So one, they focus on the individual's symptoms and not social factors that cause distress and dysfunctional behavior. Second, they have the potential to dehumanize the client through labeling. Third, they may reflect the inappropriate application of power in the therapeutic relationship. Four, they can lead to an overemphasis on individual solutions rather than social change. And fifth, they are part of a system developed mainly within psychiatry, an institution that reinforces dominant cultural norms and may become an instrument of oppression. So, feminist counseling can be particularly effective with certain mental disorders that are commonly diagnosed among women in society. Feminist counselors are reluctant to use the label mental disorder to describe symptoms of psychological distress that they view as communications about the experience of living in an unjust society. Instead, feminist counselors use a feminist analysis with alternative diagnostic systems. They consider the social meanings of diagnosis, broadening the focus to a more complex understanding of the client's experience and distress within a cultural context. So what is feminist therapy all about? So survival strategies. Feminist therapists believe that external factors and contextual factors are as important as internal dynamics in understanding the client's presenting problems. The feminist approach emphasizes that many symptoms can be understood as coping or survival strategies rather than as evidence of pathology. Due to the cultural and Next, due to the cultural and gender limitations of diagnosis, Erickson and Kress encourage therapists to be tentative in diagnosing those from diverse backgrounds and to, as a part of a more egalitarian relationship, co-construct an understanding of the problem with the client rather than imposing a diagnosis on the client. Next, egalitarian. Feminist counselors strive to create an egalitarian relationship with their clients so that the inequities found in society are not replicated in the counseling relationship. So for example, if the counselor calls the client by his or her first name, the counselor introduces him or herself using his or her first name. A strategy for empowering clients is to demystify the counseling process at the outset of the relationship by paying careful attention to informed consent issues. So it is important that clients participate in identifying and naming their problems, understand and agree to goals and procedures, realize that they are in charge of direction, length, and choices of techniques to be implemented, and know their rights as consumers of counseling services. Feminist counselors provide their clients with information about their theoretical orientation, competencies, and alternatives to counseling so that the clients can make fully informed choices. Next is avoids blaming the victim. Reframing symptoms as resistance to oppression and as coping skills or strategies for survival and shifting the etiology of the problem to the environment avoids blaming the victim for her or his problems. So assessment is viewed as an ongoing process between client and therapist and is connected to treatment interventions. In the feminist therapy process, the diagnosis of distress becomes secondary to the identification and assessment of strengths, skills, and resources. So, the emphasis of feminist therapy. The emphasis of feminist therapy is on wellness rather than a disease, resilience rather than deficits, and a celebration of diverse strengths. Diagnosis, when used, results from a shared dialogue between the client and therapist. The counselor is careful to review with the client any implications of assigning diagnosis so that the client can make an informed choice, and the discussion focuses on helping the client understand the role of socialization and culture in the etiology of these problems. Next, we have here the 10 techniques and strategies. So first is empowerment, followed by self-disclosure, gender role or social identity analysis, gender role intervention, power analysis, bibliotherapy, assertive training, reframing and relabeling, social action, and group work. Empowerment. Empowerment Empowerment to change is the most essential aspect of feminist therapy. To change, the individual must understand and remove socialized conditioning that restricts decision making based on societal expectations of what is appropriate for men and women or for members of dominant and non-dominant group members. A process of resocialization allows clients to value themselves and realize that their lived experiences are important. What was once considered pathology can be renamed as a coping mechanism. The client then begins a process of relearning and practicing new behaviors that promote egalitarian relationships. So an indicator of change is when clients actively advocate for themselves while participating in social action groups that promote societal change. So at the heart of feminist strategies is the goal of empowering the client. Feminist therapists work in an egalitarian manner and use empowerment strategies that are tailored to each client. The therapist will pay careful attention to informed consent issues, discussing ways the client can get the most from the therapy session, clarifying expectations, identifying goals, and working toward a contract that will guide the therapeutic process. Informed consent. So what is this informed consent? So informed consent offers a place to begin a relationship that is egalitarian and collaborative. So informed consent is more than a written document. It's an important part of your interactions with clients because they believe that the therapy relationship is a partnership. Feminist therapists engage in an ongoing informed consent. They let clients know why they suggest certain activities, homework, or topic areas. They check in on the therapy relationship frequently to ensure that they respect the client's questions and wishes. So, by explaining how therapy works and enlisting the client as an active partner in the therapeutic venture, the therapy process is demystified and the client becomes an equal participant. The client will learn that she is in charge of the direction, length, and procedures of her therapy. The therapist might ask, what is the most powerful thing you could do for yourself right now? The intent of that question is to interrupt the trance of powerlessness by inviting the client to notice how power is actually available to her. Given the client's cultural background, it may be particularly important to address the power within the therapeutic relationship because the client may view the therapist as an expert who holds the answer she is seeking. Self-disclosure. Feminist therapists use therapeutic self-disclosure in the best interest of the client to equalize the client-therapist relationship, to provide modeling, to normalize women's collective experiences, to empower clients, and to establish informed consent. The counselor engages in self-disclosure only when it is judged to be therapeutically helpful to the client. For example, the therapist may briefly disclose her own difficulties in relating to members of her family of origin, acknowledging that at times hiding information seems important in order to keep the peace. The counselor might share how she decides when not to be open about her personal life. The counselor could then discuss with the client ways in which they have both experienced cultural and societal pressures to conform to a heteronormative ideal. The client benefits from this modeling by a woman who does not meet society's expectations for female behavior and appearance but is comfortable with the image she has developed and how it has worked for her, not against her. The counselor's disclosure would happen over time, for it is crucial that the counselor does not overshadow the client's time to explore the concerns that bring her to therapy. So self-disclosure goes beyond sharing information and experiences. It also involves the quality of presence the therapist brings to the therapeutic sessions. Effective therapist's self-disclosure is grounded in authenticity and a sense of mutuality. The therapist explains to the client the therapeutic interventions that are likely to be employed. The client, as an informed consumer, will be involved in evaluating how well these strategies are working and the degree to which her personal goals in therapy are being met. Feminist counselors engage in self-disclosure and state their values explicitly to emphasize the commonalities among women and decrease the client's sense of isolation. Although they share with counselors of other theoretical orientations the commitment to ensuring that self-disclosures are in the client's best interest and are relevant to the client's needs. Brief and timely self-disclosures about the counselor's own struggles with issues serve the purposes of modeling coping responses to difficult issues and equalizing the therapeutic relationship. Next, gender role social identity analysis. So a hallmark of feminist therapy, gender role analysis assists clients in identifying the impact that their own gender role socialization has played in shaping their values, thoughts, and behaviors. Some feminist therapists prefer the term social identity analysis because it reflects the importance of assessing all relevant aspects of a client's identity, including multiple memberships in both socially disempowered and privileged groups. For example, the client is identified as a female, a lesbian, and a Dominican, all marginalized identity within the dominant culture. Social identity and gender role analysis begin with clients identifying the societal messages they received about how women and men should be and act, as well as how these messages interact with other important aspects of identity. The therapist begins by asking the client to identify messages she has received related to sexuality, race, ethnicity, and appearance from her culture, society, her peers, the media, and her family. The therapist talks about how body image expectations differ between females and males in our culture and how they may differ in other cultures. The therapist explains how expectations related to appearance could intersect with beliefs about what it means to be gay or straight in the client's culture, family, and society as it relates to her working environment. As the client identifies the messages playing in her head and voices behind those messages, she is living with a mindfulness of her internalized oppression. The client decides what messages she would prefer to have in her mind and keeps an open awareness when the discounting messages play in her head. The goal is for the client to adopt realistic and affirming internal messages. Next, gender role intervention. The gender role analysis is an intervention strategy used to help clients learn about the impact of culturally prescribed gender role expectations on women and how their lives are affected by them. In a collaborative effort, the counselor and client examine the client's values and how these values are reflected in the client's role expectations for himself or herself and others. They identify the explicit and implicit sex role messages the client has experienced and internalized. They then decide which of these messages the client wants to change. During this process, the clients learn that their methods of coping have been adaptive for living in an oppressive society rather than symptoms of pathology. They develop an empathic rather than self-blaming attitude towards themselves. Thus, the gender role analysis serves to help clients gain self-knowledge, increase their awareness of social-cultural basis for distress, and identify areas for desired change. So following the analysis, a plan for implementing changes is developed that may draw on cognitive, behavioral, or other strategies as appropriate to the client's needs. Using this technique, the therapist responds to the client's concern by placing it in the context of society's role expectations for women. The aim is to provide the client with insight into the way social issues are affecting her. The therapist responds to her statement with, "Our society really focuses sometimes unrealistic beauty ideals with females. The media bombards the girls and women with the message that they must be thin, have long hair, straight hair, and wear attractive clothing. The message is so ingrained that many girls are struggling with self-esteem issues related to their appearance as early as elementary school to avoid being bullied or to fit in." So by placing the client's concern in the context of societal expectations, the therapist gives the client insight into how these expectations have affected her psychological condition and have contributed to to her feeling depressed and anxious about judgment from others. So the therapist's statement also paves the way for the client to think more positively about her unity with other women and even to think about how she might contribute as a role models for girls and young women in the future. The client is increasing her awareness of the strong role media play in perpetuating over sexualized images of women and how these images affect her self-esteem. The client may decide to begin a dialogue with other women to discuss ways to create a significant change. So power analysis. Power analysis is an assessment and intervention strategy that aims to help women understand their devalued status in society and to help clients of both sexes become aware of the power difference between men and women. So the counselor may begin by educating the client about various kinds of power and women's limited access to most kinds of power. So women are often uncomfortable with the term power because of their limited experience or exposure to only aggressive aggressive aspects of it. The counselor may help clients understand the differences between power over, which implies dominance or oppression, power within, which involves feeling that one has inner strength, and power to, which refers to goal-directed behavior that respects the rights of all involved. So clients can then offer their own definition of power and consider how it is for their ways of being in the world. Together, the counselor and client identify the client's usual means of exerting power and the effectiveness of those means. Next, they identify ways in which the client's internalized gender role messages affect his or her use of power, which synthesizes gender role and power issues for the client. Fi- Finally, clients are encouraged to increase their repertoire of power strategies by experimenting in areas of their lives in which a lack of power previously prevented change. So, power analysis empowers clients to challenge and change the oppressive environments in which they live. Power analysis also refers to the range of methods aimed at helping clients understand how unequal access to power and resources can influence personal realities. So together, therapists and clients analyze how various forms of power in the dominant and subordinate group limit self-definition and well-being. So the client will become aware of the power difference between men and women, as well as the power differences associated with sexual orientation and ethnic status in our society. Specific issues related to the client's cultural perspective also are explored. So the power analysis may focus on helping the client identify alternate kinds of power she may exercise and learn how to challenge the gender role messages that prohibit the exercise of that kind of power. So the client choreographs the changes she wants to make in her life. So interventions are aimed at helping that person learn to appreciate herself as she is, regain her self-confidence based on the personality attributes she possesses, and set goals that will be fulfilling to her within the context of her cultural values. Is bibliotherapy. So nonfiction books, psychology counseling, textbooks, autobiographies, self-help books, educational videos, films, and even novels can all be used as bibliotherapy resources. So reading about feminist and multicultural perspective on common issues in women's lives, example, incest, rape, domestic violence, and sexual harassment, it may challenge a woman's tendency to blame herself for these problems. So the therapist describes a number of books that addresses issues of relevance to the client, and she selects one to read over the next few weeks. So providing the client with reading material increases knowledge and decreases the power difference between the client and therapist. Reading can supplement what is learned in the therapy sessions, and the client can enhance her therapy by exploring her reactions to what she is reading. For women with diverse social identities, books, um, biographies, and memoir written by women with similar or related identities can provide concrete examples of empowerment and can facilitate growth. So bibliotherapy, although not unique to feminist counseling, is another strategy that feminists often find useful. Bibliotherapy involves reading books and processing books or articles carefully chosen to help the client understand societal influences that affect his or her personal experience. So, this literature may address issues such as a woman's body image and appearance, sexual violence, relationships, and aspects of the lifespan. For example, a client concerned about her relationship with a significant other might be asked to read Learner's 1989 or The Dance of Intimacy. So such reading assignments serve to empower clients by by increasing their expertise on topics of concern to them. Next, assertive training. So another intervention strategy that has been associated with uh, feminist counseling is assertiveness training. So when women do not feel powerful, they may not act assertively and thus may give up some control over their lives. So feminist counselors teach clients assertiveness skills using direct teaching methods, bibliotherapy, and role play. So through assertiveness training, women learn to stand up for their rights without violating the rights of others. The aim of this training is to facilitate women's use of personal power to achieve personal change and effectively challenge their environment. So, by teaching and promoting assertive behavior, women become aware of their interpersonal rights, transcend to stereotypical gender roles, and change negative beliefs and implement changes in their daily life. So the client may learn how sexism has contributed to keeping females passive. For example, a woman behaving in an assertive way is often labeled as aggressive, but similar behavior in men may be viewed as assertive. So the therapist and client consider what is culturally appropriate, and the client decides when and how to be assertive, balancing the potential costs and benefits of assertiveness within the ecological context relevant to the client. The therapist helps the client evaluate and anticipate the consequences of behaving assertively, which might range from criticism to actually getting what she wants. So, through learning and practicing assertive behaviors and communication, the client may increase her own power, which will ameliorate her depression and anxiety. The client learns that it, it is her right to ask for what she wants and needs in the workplace. Next, reframing and relabeling. So like bibliotherapy, therapist self-disclosure and assertiveness training, reframing is not unique to feminist therapy. However, reframing is applied uniquely in feminist therapy. Reframing includes a shift from placing the problem internally and blaming the victim to a consideration of social factors in the environment that contribute to a client's problem. Rather than dwelling exclusively on intrapsychic factors, the focus is on examining societal or political dimensions. So the client may come to understand that her depression and anxiety are linked to social pressures to behave within heteronormative gender role expectations and to develop an appearance that matches these culturally and societally prescribed ideals. So relabeling is an intervention that changes the label or evaluation applied to some behavioral characteristic. So the client can change certain labels she has attached to herself, such as being inadequate to socially unwanted or socially unwanted because she does not conform to ideas commonly associated with femininity. An example might be that the client is encouraged to talk about herself as a strong and healthy woman rather than as being selfish or too masculine. So, reframing and relabeling are intervention strategies frequently used in feminist counseling. To reframe is to change the frame of reference for looking at an individual's behavior. So, when feminists counselors reframe a client's behavior, they consider the socio-political and cultural contributions to the client's issues, thus shifting the etiology from the problem from the individual to the environment. So this change in perspective avoids blaming the victim for his or her own problem. So negative labeling, such as defining a behavior as dysfunctional, is relabeled as a positive coping strategy. So feminist characteristics such as sensitivity, compassion, or subjectivity that may be devalued as weaknesses when viewed through an androcentric lens are revalued as strengths through the feminist lens. So thus, through reframing and relabeling, symptoms can be seen as coping mechanisms and weaknesses can be seen as strengths. So, social action or social activism, it is an essential quality of feminist counseling. So, as clients become more grounded in their understanding of feminism, therapists may suggest that clients become involved in activities such as volunteering at a rape crisis center, lobbying lawmakers, or providing community education about gender issues. So, participating in such activities can empower clients and help them see the link between their personal experiences and the socio-political context in which they live. The client might decide to join and participate in organizations that are working to change societal stereotypes about female beauty expectations for women, or social groups that affirm people who identify with a variety of sexual and affectional orientation. So, participating in social action can increase self-esteem and a sense of personal power. Next, group work. Feminist therapists often encourage their clients to make the transition from individual therapy to a group format, such as joining a support group or a political action group as soon as this is. So although these groups are as diverse as the women who comprise them, they share a common denominator emphasizing support for the experience of women. The literature reveals that women who join these groups eventually realize that they are not alone and gain validation for their experiences by participating in the group. So these groups can provide women with a social network, a decreased feeling of isolation, create an environment that encourages sharing of experiences, and help women realize that they are not alone in their experiences. Uh, Groups provide a place where women are valued and affirmed, and where they can share and begin to critically explore the messages they have internalized about their self-worth and their place in society. The self-disclosures of both the members and the leader foster deeper self-exploration, a sense of universality, and increased levels of cohesion. So members learn to use power effectively by providing support to one another, practicing behavioral skills, considering social, political actions, and taking interpersonal risk in a safe setting. So through their group participation, women learn that their individual experiences are frequently rooted in problems within the system. So, participation in a group experience can inspire women to take up some form of social action. So, indeed, a form of homework can be to carry out what women are learning in the group to bring about changes in their lives outside of the group. So, the client and her therapist will likely discuss the possibility of her joining a women's support group, a gay straight alliance, or another type of group as a part of the process of terminating individual therapy. So participating in a group can enhance the client's sense of community. She will witness the journey of personal and collective transformation and growth as she adds to her group of supporters, encouragers, and teachers. So other women can provide her with nurturance and support, and the client will have the chance to be significant to other women as they engage in their healing process. So the role of men in feminist therapy. So men can be feminist therapists, and feminist therapy can be practiced with male clients. So it is an erroneous perception that feminist therapy is conducted only by women and for women, or that feminist therapy is anti-men because it is pro-women. So although the original feminist therapists were all women, men have now joined their ranks. So male feminist therapists are willing to understand and own their male privilege, confront sexist behavior in themselves and others, redefine masculinity and femininity according to other than traditional values, work toward establishing egalitarian relationships, and actively engage in support actively engage in and support women's efforts to create a just society. So the principles and practices of feminist psychotherapy are useful in working with male clients. So individuals from diverse racial and cultural backgrounds, and people who are committed to addressing social justice issues in counseling practice. So, social mandates about masculinity, such as restrictive emotionality, overvaluing power and control, the sexualization of emotion, and obsession with achievement, can be limited to males. So, female counselors who work with male clients have an opportunity to create an accepting, authentic, and safe climate in which men can reflect on their needs, choices, past and present pain, and hopes for their future. So, by using relational cultural theory, female counselors provide a forum for men to consider the context that help shape them. So any presenting issue of male clients can be dealt with from a feminist perspective. So for a comprehensive treatment of counseling, men in specialized modalities and settings, intersections of identity, and specialized populations and concerns. So, feminist therapy is not just suitable for women, men can benefit from this therapeutic process as well. Men also deal with social and gender role constraints such as demands of strength, autonomy, and competition. In addition, they are limited by the notion that they should not express vulnerability, sensitivity, and empathy. So both men and women are exploited by a patriarchal society, and limited culture, and gender stereotypes. So men can benefit from therapy by working on these issues and by learning new skills to help them understand and explore issues involved with emotions, intimacy, and self-disclosure. Next, feminist therapy from a multicultural and social justice perspective. So strengths from a diversity perspective. So of all the theoretical approaches to counseling and psychotherapy in this topic, so feminist therapy has the most common with multicultural and social justice perspective. So historically, multicultural approaches evolved in response to societal oppression, discrimination, and marginalization faced by people of color. Over time, the multicultural perspective has made counseling more inclusive. Contemporary counselors who infuse their work with a multicultural perspective address a wide variety of inequities that limit full participation in society. So the social justice perspective in counseling aims to empower the individual as well as to confront injustice and inequality in society. So although multicultural feminist and social justice counseling have been viewed as disparate models, they have many common threads. So all three approaches emphasize the need to promote social, political, and environmental changes within the counseling context. So practitioners of all three perspectives strive to create an egalitarian relationship in which counselor and client co-construct the client's problems from a contextual perspective and collaborate in setting goals and choosing strategies. All three approaches reject the disease model of psychopathology, wherein they view clients' problems as symptoms of their experiences of living in an unjust society rather than as having an intrapsychic origin. So culturally competent feminist therapist looks for a way to work within the context of the client's culture by exploring the consequences and alternatives. They appreciate the complexities involved in changing within one's culture but do not view culture as sacrosanct. It is important to understand and respect diverse cultures, but most cultural contexts have both positive and toxic aspects, and the toxic aspects that oppress and marginalize groups of people need to be explored. So feminist therapists are committed to taking a critical look at cultural beliefs and practices that discriminate against, subordinate, and restrict the potential of group of individuals. So next is the shortcomings from a diversity perspective. So feminist practitioners advocate for change in the social structure, especially in the areas of inequality, power in relationships, the right to self-determination, freedom to pursue a career outside or inside the home, and the right to an education. So this agenda could pose some problems when working with women who do not share these beliefs. So it is acknowledged that if therapists do not fully understand and respect the cultural values of clients from diverse groups, they run the risk of imposing their own values. So Rimmer claims that a potential danger inherent in feminist counseling is that counselors' values will too strongly influence clients or will conflict with clients' values. So being aware of the cultural context is especially important when feminist therapists work with women from cultures that endorse culturally prescribed roles that keep women in a subservient place or that are grounded in patriarchy. So consider this scenario. You are a feminist therapist working with a Vietnamese woman who is struggling to find a way to be true to her culture and also follows her own educational and career aspirations. Your client is a student in a helping profession who is being subjected to extreme pressure from her father to return home and take care of her family. Although she wants to complete a degree and eventually help others in the Vietnamese community, she feels a great deal of guilt when she considers selfishly pursuing her education when her family at home needs her. So, in this complex situation, the therapist is challenged to work together with the client to find a path that enables her to consider her own individual goals without ignoring or devaluing her collectivistic cultural values. So the therapist's job is not to take away her pain or her struggle or to choose for the client, but to be present in such a way that the client will truly be empowered to make significant decisions. So the feminist counselor must remain aware that the price may be very high if this woman chooses to go against what is culturally expected of her, and that the client is the one to ultimately decide which path to follow. So, as can be seen from the example I've stated, to minimize this potential shortcoming of imposing cultural values on a client, it is essential that therapists understand how their own cultural perspectives are likely to influence their interventions with culturally diverse clients. So, a safeguard against value imposition is for feminist therapists to clearly present their values to clients early in the course of the counseling relationship so that clients can make an informed choice about continuing this relationship. Next is the feminist therapy primary tenet. So the personal is also the political. So also, although feminist counselors practice in various ways depending on their approach. In general, they share a commitment to core set of principles. So the first and most fundamental of these principles is that the personal is political. So the basis for this belief is that the personal or individual problems that women and members of other subordinate groups bring to counseling originate in social and political oppression, subordination, and stereotyping. Thus, the goal of feminist counseling is not only individual change but also social transformation. So, clients' responses are not viewed as dysfunctional or as having an intrapsychic origin but are seen as ways of coping with an oppressive environment in which the clients have a subordinate status. So, because the environment is a major source of pathology in the lives of women and other oppressed minorities, the toxic aspects of the environment must be changed if individual change is to occur. So, it would be all for my report. Thank you. So, any thoughts, questions, concerns, and complaints? So, thank you so much again for listening.